The Longevity Game podcast is now on the air.
What's up, everybody? How's everybody doing? Welcome to the Longevity Game podcast, where we teach you guys how to battle Father Time to get your health back. Yeah. All right. So, guys, today we're just going to talk about just one thing, and that is which labs do you really need if you're going to be evaluated for low testosterone? This is pretty important. You know, I see people come in from other clinics because they're greatly disappointed usually in the care that they receive. And I find out inadvertently what kind of labs that they initially had pulled. And I'm always baffled as to why people don't draw certain labs. And so today we're just going to get into that. If you're going to go get your testosterone checked, these are the labs that you need to have drawn, okay? So first we're going to start with the CBC. And the CBC is a complete blood count. And the complete blood count is just going to tell you how many red blood cells you have, how many white blood cells you have. It's going to tell you what shape and what size your blood cells are. It's going to tell you how many platelets you have, and you know it's going to tell us a story. And so the next thing that we check is a CMP, a comprehensive metabolic panel. And I get the CMP instead of a basic metabolic panel because I want to see what the liver's doing. You know, I want to see, I want to make sure that, you know, a lot of the times the guys that come into my clinic, you know, they either have a primary care provider that they don't go see, or they don't have a primary care provider at all, right? And so I like to use this time because, you know, to really see what's going on under the hood, right? Because this may be the only time this person goes to be evaluated. Who knows? And who knows how long? You know, if he doesn't qualify for testosterone based on his labs and his symptoms, then, you know, he might not go back to the physician, you know, or physician's office. My gosh, it could be years, you know? And so we want to make sure that we catch something. So I look at the liver, I look at the kidneys, you know, and that's, and then I look at how the body handles the, you know, its electrolytes and just metabolically overall how it's functioning. And so there'll be a carbon dioxide, or really a serum bicarb is what that reflects, but calcium, magnesium, sodium, potassium, and then it'll tell me what your, you know, what your creatinine and your BUN levels are, which is your kidney function. It's going to tell me what your AST and ALT and alkaline phosphatase and total bilirubin and albumin are, you know. So that's a comprehensive metabolic panel. And then next I'll check your lipid profile. I'm going to check your total testosterone. I'm going to check your LDL. I'm going to check your HDL. I'm going to check your triglycerides, right? And so it's really important to know because all these things that I really check are also going to be impacted by testosterone. And so, you know, you definitely want to get a really great baseline. And so the next thing I'm going to check is the TSH, the thyroid stimulating hormone. And I get a thyroid stimulating hormone because some of the symptoms that people have with low testosterone actually are similar to symptoms that you may experience whenever you have a suboptimal thyroid or low thyroid function. And so I check a TSH. But if you wanted to really dive in, if you're really concerned about thyroid, you know, you want to find out, you know, the TSH, thyroid stimulating hormone, but also a free T4 and a free T3. And the reason I get a free T4 is because a free T4 is the inactive form of thyroid hormone. And so your pituitary gland sends TSH to your thyroid. That the thyroid in response to low levels of T3 most of the time. And then so your body takes the TSH stimulates T4, and then the body takes the T4 and converts it to T3. And so I get a free T4 and a free T3. And the T3 is the active form of thyroid hormone. And so I check a free T3 because sometimes people don't convert T4 very well to T3. And so they could have a normal TSH, a normal T4, but their T3 is low. And that's reflected by their symptoms, and that could be all kinds of things that are similar to testosterone. Fatigue, really, really low energy levels, just feeling blah all the time, down in the dumps. Some people, are with low thyroid function, are diagnosed with chronic fatigue syndrome, depression, that kind of thing. Can't lose weight, or you gain weight easily, all that stuff, which is similar to what happens whenever you're on testosterone, or at least some of the symptoms. And so I like to dive into the thyroid. And then you want to check an LH and an FSH. An LH and an FSH. LH stands for luteinizing hormone. And luteinizing hormone is a hormone that's secreted from the pituitary gland that tells the testicles to make testosterone. And FSH is follicle stimulating hormone. And that's a hormone that's secreted from the pituitary gland that causes your body to make more sperm. All right? And so if those levels are zero, undetectable, there could be two reasons why that would be. One, this person is taking some medication like an anabolic steroid that could be suppressing LH and FSH, or they're taking testosterone that's already, and it suppressed their LH and FSH. There is one additional thing that could cause a very low or undetectable LH and FSH, and that is a tumor, like a pituitary adenoma. And so I always start therapy only after finding out what their LH and FSH is, because if their LH is pointing, and if their LH and FSH are zero, man, they got a tumor, or possibly. I've caught a few tumors this way. And so, from there, I'd take them to get a CT of the tela turcica, so they can be evaluated for a tumor right there, right on the pituitary gland. And then you'd be surprised how many people don't get an LH and FSH. It is super important because, if they don't have LH and FSH floating around, that's your sign. You need to send them to a CT. I wonder how many people have missed that. Anyway, the next one would be a estradiol. Estradiol is the female hormone, or the one that's synonymous with females, and most men are scared of estradiol, but because of their concern of developing gynecomastia, which happens as a very, very small percentage of men, and it's a genetic issue. However, that being said, we want to get a baseline estradiol, and because whenever you're on testosterone, men make estradiol from testosterone through aromatization. And that aromatization is the process of the body converting estradiol from testosterone. And so your estradiol levels are going to increase over time. And so we want to just keep an eye on, get a baseline, find out where you're at, and then just keep an eye on those. Some people don't even treat high estrogen levels in men. I am of the opinion that if somebody's having estrogenic side effects, then we'll treat them very, very conservatively for a very short amount of time, just to get those levels down a little bit back to normal. But I don't put somebody on an estrogen blocker just because they have high estrogen. That's pretty silly, because it's it's just one of those things. It's going to happen. Your body is making estrogen on purpose for a reason. So. The next thing I get is a total testosterone and a free testosterone. So a free testosterone is all the testosterone left over after the total testosterone is being utilized, right? So there's all kinds of plasma proteins that bind to testosterone in the circulatory system, like sex hormone binding globulin, and we grab one of those we check that. And then albumin. Albumin can bind loosely to testosterone, but it does make it unbioavailable. And so the free testosterone is what's left over. And so the free testosterone is the level is important, because the free testosterone is what really causes the symptoms of low testosterone. It's the testosterone that's left over. There's a lot of people that don't draw free testosterone, and it's like, why? They have a total testosterone of 600, but their free testosterone's 5. That's a problem, And so it's really, really important to check that free testosterone. And then, having a prolactin level drawn is not a bad idea as well. Prolactin is, it's another hormone secreted by the pituitary gland. And prolactin can, if it's high, it can indirectly lower testosterone. And the way that it does that is it suppresses gonadotropin releasing hormone. And that's a hormone that stimulates LH and FSH, right? So if the gonadotropin releasing hormone is very low and the prolactin is very high, then that means the LH is going to be very low, which LH, if you remember, I said that it stimulates the testicles to make testosterone. So there's really a big cascade of events that happen, with the final result being really estradiol, but testosterone then estradiol. And so if your prolactin is high, it could be a result of taking a few different types of medications like the antidepressants or antipsychotics or opiates. Those three things can drive up prolactin. However, the most significant finding and the most widely recognized result of a high prolactin is a prolactinoma, which is a pituitary adenoma that secretes prolactin. And so if you draw a prolactin level and it's crazy, crazy high, then there's probably a pituitary adenoma that's causing that, especially if this patient's not on any of those three medications I told you, antipsychotics, antidepressants, or opiates. And so the first step is, I'm probably, digressing a little bit, but the first step you would do is you would probably put them on a medication, a dopamine agonist, like cabergoline, that's the gold standard for that. Or if they have reactions to that, you put them on bromocriptine, and it's just 1 to 2 times weekly. And if it's worse, if it's not responding, then it's probably a pretty large pituitary adenoma. Of course, you're going to get imaging, and you're not going to really, if you're a provider in this space, you're probably not going to do anything other than send them to a specialist. But and so you probably won't even put them on the cabergoline. You probably just say, hey, you need to go to an oncologist. You pour them to oncologist. But these things are, as an ICU intensivist nurse practitioner, I go a little deeper, because I've been doing that for a long time. And so, what you do is, like I said, cabergoline or bromocriptine. If that doesn't work, then they probably should go to surgical oncology, have the pituitary adenoma evaluated and possibly removed. And if it needs to be surgically removed, then it's actually classified as a macroadenoma. And so this is the importance of getting a prolactin, especially if their LH is super low, because if their LH and FSH are low, it does point to possibly a prolactin issue. And then, you can follow that rabbit trail. So let me just summarize. CBC, CMP, TSH, a lipid panel, which includes a LDL, HDL, triglycerides, total cholesterol, a LH and FSH, a total testosterone, free testosterone with SHBG, an estradiol, and then a prolactin. And that's for men who are being evaluated for low testosterone. And that's it. So I hope that helps. If you have any questions or comments, I encourage you to drop me some questions or comments below. And if you are interested in being a guest on the Longevity Game Podcast, you can just email beaguest@thelongevitygamepodcast.com. And if you have any questions or you have some content ideas or some requests, you can go to or send me an email at hello@thelongevitygamepodcast.com. All right, guys, it's been a pleasure, and I will catch you guys later. Have a great day today. Yeah.